Hello from the Center for Livable Cities and a warm welcome to the 12th episode in our CLC webinar series, Cities Adapting to a Disrupted World. I'm your host, Dinesh Naidu. Today's webinar is co-organized with UN Habitat and is titled UN Habitat Supporting Cities Through COVID-19. We have a very diverse panel joining us from Malaysia, Liberia, Kenya, Mauritius, and of course, Singapore. But first, some housekeeping. Simultaneous interpretation in Mandarin is available for this webinar. To access this, click on the Interpretation tab on your Zoom toolbar and then select Chinese. Our speaker slides can be found on our website as well. Now, today's webinar is significant because it also marks the renewal of the Memorandum of Understanding between the Government of Singapore and UN Habitat. We'd like to commence the MOU signing ceremony by inviting Ms. Indrani Raja, Minister in Singapore's Prime Minister's Office, and Second Minister of Finance and National Development to give her opening remarks. Minister Indrani, the mic is yours.
Dato Maimunah Sharif, Executive Director, UN Habitat. Ladies and gentlemen, since everyone is from different time zones, I'll have to say good morning, good afternoon, good evening, wherever you are, but wherever you happen to be, welcome. We're here today to celebrate the strong partnership between the Government of Singapore and UN Habitat in providing capacity building support and technical assistance to emerging cities in developing regions. Singapore and UN Habitat have been working closely together to curate development programs for leaders and planners from emerging cities in developing countries. With these programs, participants are able to meet experienced practitioners from Singapore and the United Nations, pick up ideas and knowledge on sustainable urban solutions and governance strategies, and tailor them for implementation in cities. This would support cities in working towards Sustainable Development Goal SDG 11 and the United Nations New Urban Agenda to rethink the way cities are built, managed, and experienced. We've received good feedback from participants since our MOU was signed in 2016. Participants from more than 40 countries across Africa and South America were able to bring the urbanization strategies developed in consultation with experts back to their cities to address various urban developmental issues, including affordable housing, public transportation, and land management. Our collaboration is reaching the 5-year mark, and it's timely for us to reaffirm our commitment with the renewed MOU and formalize a strengthening of our partnership with a broader scope of cooperation. Today, Singapore is refreshing our partnership with UN Habitat to work with up to 100 cities and support them in their journey to reach their urban development and sustainability goals by 2030. This will not only involve delivering capacity building to support cities in their planning, innovation, and implementation of projects to catalyze change. We will also work with UN Habitat to provide clarity on the SDGs and how to achieve them. At the same time, we will assist cities to understand possible financing sources and models to execute projects and monitor and evaluate progress of activities related to the capacity building programs for continuous improvement. With the renewed MOU, our support for developing cities will not be limited to the curation of capacity building courses. We will go further to now include knowledge sharing on international platforms such as the World Urban Forum in 2022 and our upcoming World City Summit in June 2021. The renewal will also extend the reach for our joint development programs to other parts of the world beyond Africa and South America. With the renewal of this MOU, our strong and growing partnership with UN Habitat will continue to cater for the pressing need of ensuring sustainable urbanization in developing cities. We look forward to our continued collaboration with UN Habitat in supporting the sustainable development of unfolding urban futures around the world. Thank you.
Thank you, Minister Indrani. May I now invite UN Habitat Executive Director Dato Sri Maimunah Muhammad Sharif to give her opening remarks. Edie Maimunah, the mic is yours.
Thank you very much, Dinesh. Thank you very much, Honorable Second Minister of National Development, Ms. Indrani Raja, Executive Director of the Center for Livable Cities, Mr. Koo Teng Chai, Honorable Mayors, friends, colleagues, ladies and gentlemen. Good morning, good afternoon or evening from wherever you are in this world, in the new normal. It is my pleasure to join this webinar today on the theme of cities adapting to a disrupted world, and with a focus on the support provided by UN Habitat to cities throughout the world in response to the COVID-19 pandemic. Today is also an important day as we are renewing our partnership with the government of Singapore. The government of Singapore and UN Habitat joined hands in 2016 and signed an agreement on the sidelines of the 3rd UN Conference on Housing and Sustainable Urban Development, or Habitat 3, in Quito, Ecuador. The partnership was meant to share successful urban practices with emerging cities from developing countries in support of the implementation of the 2030 Agenda, especially this SDG 11 and the new urban agenda. Our past partnership has allowed 80 city senior leaders of more than 15 African cities to participate in the Singapore UN Habitat International Leaders in Urban Governance Program since 2017. The COVID-19 pandemic has demonstrated how, more than ever, collaboration at all levels is crucial to make cities and human settlement inclusive, safe, resilient, and sustainable. Indeed, urban areas have been at the epicenter of the COVID-19 pandemic, accounting for an estimate 90% of cases. And with 1 billion people living in informal settlement or slum or inadequate housing, with no sufficient means to afford preventive measures, it is easy to understand that a large part of the global population is now in an even more vulnerable situation. There is an urgent need to work with the communities as well with the city leaders to build more resilient cities. Over the last months, UN Habitat has worked in field, conducting activities in over 260 cities, providing support to local authorities and developing community-driven solutions. For many cities, the COVID-19 health crisis has expanded to a crisis of urban access, urban equity, urban finance, safety, joblessness, public services, infrastructure and transport, and of all which disproportionately affecting the most vulnerable in society. So the COVID-19 crisis exacerbates the critical role that local governments play as frontline actors for response, recovery, and rebuilding, particularly through service delivery, economic development, and infrastructure investment. So it is therefore urgent to provide as much capacity building support as possible in order to enhance city leaders' response to the crisis and strengthen the resilient cities and urban communities. We are looking forward to strengthening our partnership with the government of Singapore and the Center for Livable Cities to help build the capacities of city leaders and promote thought leadership through the World City Summit, the Advanced Urban Governance Program, and the World Urban Forum. Thank you very much.
Thank you, Edie Maimunah. We would now like to invite Minister Indrani and Edie Maimunah to sign the MOU. This is the second MOU that the Government of Singapore will be signing with UN Habitat. Through this, the Center for Livable Cities and UN Habitat aim to support up to 100 cities in achieving their urban development and sustainability goals by 2030. Now, I'd like to invite Minister Indrani and ED Maimunah to present their signed MOUs to the camera and take a photo. 3, 2, 1. Thank you so much, Minister Indrani and ED Maimunah. I'm now honored to welcome and introduce ED Maimunah to give a keynote presentation. Dato Seri Maimunah Muhammad Sharif is the Executive Director of the United Nations Human Settlements Program, or UN Habitat, appointed at the level of Under-Secretary General by the Secretary General of the United Nations. Before this, Dato Sri Maimunah was the Mayor of the City Council of Penang Island in Malaysia. In 2011, she was the first woman to be appointed President of the Municipal Council of Seberang Perai. As Mayor of a local authority, she led the council to achieve its vision of a cleaner, greener, safer, and healthier place to work, live, invest, and play. Without further ado, ED Maimunah, the mic is yours.
Thank you very much, Dinesh, for that introductions. The topic given to me this afternoon is supporting cities during COVID-19, is what UN Habitat has been doing all this while, not only since March, but also before that, but it was been really increased in terms of the awareness of the cities, and at the same time, our program to the areas, especially in the most vulnerable situation. So I would like to go to the first slide, please. Yes, COVID-19 is really a wake-up call for everyone at all levels, not only at the government, it's also at the global institution, in the UNs, civil society, governments at the national government, regional government, local government, private sectors, and also the communities. So cities are facing an unprecedented challenge with COVID-19 and pandemic. I think you know that cities is also the engine of growth. Cities is also producing around 70% of the carbon emission, and also using the energy at least 70%. And there is a pull factor and a push factor in the cities, as what our Secretary General Antonio Guterres mentioned, that this now is the moment for international community to hit the current wake-up call and move ahead with collective response. We cannot do it alone. Collective response in unity and solidarity. I think that is very important for us to see that this is, we work as one, and the solidarity and unity is very important. This also demonstrates us now that we are working together with the government of Singapore and the Center for Livable Cities to do capacity building, and also to leverage our existing collaboration and to move further in time to come. Next. And at the same time, there are also more evidence that meeting the Sustainable Development Goals in all countries is a matter of urgency now. I think it's a wake-up call for us to strengthen our urban system, to make cities more resilient to all changes. We cannot go back before the COVID. We have to move forward, and we are facing this, and we will facing this in the future, to build back better, build back greener, and build back more resilient. So I think this is very important for us to sharpen our awareness that we are global interdependence, and the importance of our collective pledge to leave no one behind. I think this is the test, that the mantra that we have been saying all this while, sustainable cities, inclusivity, leaving no one behind. I think the COVID-19 proved what has been gone wrong, and what is we have to strengthen and make it right, and continue to improve. The new way of designing the relationship between government and private sector, and put public at the center. Because at the end of the day, there are people in the country, people in the society, people in the local government that is affected. And we'll have to look into the less, I think, the most resilient way, and especially in the least developed countries, there must be a synergy for the global collaboration, and also a global unity in tackling this. So I think this is very important. Next, please. And what are the UN habitats has been doing all this while? I think, as you know, that our mandate is for the human settlement, and our mandate is also SDG 11, and you know that SDG 11 is the docking station for all the SDGs. And as early in March 2020, we are already putting up a policy and program framework for how to tackle the COVID-19 at that time, more on the response. So we realized that throughout our program, throughout our existence all this while, the local government and the community is very, very important. It's proven when there's around 70% or more, the COVID-19 is in cities, and cities is the epicenter of the COVID-19. And who are the front liner? It's the local government and the community. So with that realization, our focus area as early as in March to support local government and community-driven solution. Because community, they know what they need. They know what they cannot do, and they know what they can do. So we are giving them the enabling environment for them to drive their own solution, and within the local asset and also nature base. So also on top of that, we realized that we need to really an urban data. The data is very important for the mayors, for the decision makers to even to give their service delivery. Where are the people in needs? Where are the standpipe? Where are the water supply? So we putting up the urban context in terms of the data, and also at the same time mapping, and also this trying to help them through our knowledge and try to mitigate economic impact, and as early as that we are already thinking of initiate how to recover. Recovery meaning that's not only in the big the economic, but it's recover from understanding the COVID-19. What is the impact of COVID-19? How can you, in terms of communication, how can we communicate all the SOP that been developed by the World Health Organization and developed by the central government, and through active learning, and also at the same time policy measures and practices. I think this is very, very important. That is the first immediate action, and immediately we came out with 1.3 million US dollar and with a immediate project to be implemented within 3 months at that time, from March to June, and with the 13 project and 1.3 million. So because we are not a big organization, but we're a big mandate, what we do is that we collaborate with other UN agencies, and we also with the government and the civil society and communities. So this is very important for us to do that. Next. And we, UN Habitat, as you know, we have a part of our work is a normative part, normative tools, and also at the same time on the project on the ground. So immediately, the Secretary General came out with the immediate socio-economic response to COVID-19. We were one of the UN agencies been involved in this preparation of the Secretary General's report on the cluster number 5, is on the pillar number 5 on the communities and also the civil society engagement. And at the same time, we are also been asked by the Secretary General to be the pen holder on the COVID-19 in an urban world. So I really recommend the viewers and also the participants in this webinar to look into the framework of the socio-economic response and also the COVID-19 in an urban world, where really look into the gap between development and poverty, and also to the importance of the local government and the governors, and looking into the new business model. At the same time, on our own initiative, we came out with the UN Habitat guidance on COVID-19 and public spaces. And it's very much important that all this while UN Habitat is also working together a few program with government of Singapore, the importance of public space. I think it's really tested during COVID-19 because people been asked to physical distance, and public space is very, very important. At the same time, the importance of integrated territorial planning. We work together with the World Health Organization, came up with the compendium to how can we include health in the territorial spatial planning. So this is very important, that health is not a social cost, but it actually is, we need to invest in health. And we came out, of course, with our UN Habitat COVID-19 response plan in April, putting up the proposal for 64 countries with 72 million funding for us, in order for us to implement our COVID-19 together with other UN agencies and other organizations. But of course now we are in the middle of preparing the future cities, the future state of cities in the world of pandemic. What shall we do? What is the new city will look like? So hopefully this publication, our normative work will be completed by end of this year or early next year. So this is one of the contribution, apart from working on the ground, at the same time also putting up, helping the cities and the decision makers for them to make a decision in their own countries, cities, and also at the local level. Next. And so far, the UN Habitat Response Plan, you can check on our website. We are putting up in all continents, in Africa, Arab state, Asia Pacific, Latin America. We receive around the global response 2.4 million, and 25 million out of the 72 million has been collected. And for us is, yes, we trying to be a catalytic. We will try to invite the other partners, donors, to work together with us and to scale up the program that will really benefit the people immediate, medium term, long term, and of course is in the sustainable term. So this is the providing special effort to coordinating and leveraging key network and partnership for quick response. So I think this is very important for us to work together with all of you, at either at the country and city levels, and we support the socio-economic analysis of COVID-19. And our program, as I said just now, we would like to scale up this program in the various countries. You can see that in Africa, we need 33.3 million in 20 countries. We have all the detailed program already, all the detailed projects, and also the criteria why we choose the countries and the cities. So you can get it from our website. Next. And the result, we remember when I mentioned to you about our COVID-19 response plan, we launched it in April 2020, and by October, 6 months after we implement, we launch, we already come out with the 71 projects being implemented, and benefit estimate of 6.8 million beneficiaries. We operate in the 37 countries, and in terms of cities, 262 cities, and we managed to collaborate together with 28 donors, and the number of partners on the ground more than 250 partners. So we provided special effort to coordinate, and at the same time, I think it is very important for us to, as I said, we put up our program, and we would like to scale up the program which has already positive impact on the ground, and we are welcome the collaboration with all of you. Next, please. And on this response, we are also more on the emergency and COVID-19 prevention, preparedness, and emergency response, and we focus in the informal settlements. This is a program is in Kenya and in Ghana, where we collaborate with other UN agencies like UNICEF, UNDP, and UN Habitat, and also in areas like the UNHCR, with the local government and other partners. We provide the PPEs, the wash facilities to the informal settlement, because there are lack of water, and we asked to wash the hand, but there is no water supply in that area, but we provide at least a communal washing station in order for these vulnerable communities at least to strengthen their capacity to face the crisis. I think this in informal settlement in Ghana, for instance, it was clear that the communities could not afford the preventive measures. So we putting up the mechanical hand washing, and we also supported the training of 14,600 members in Tulaku on the importance of a clean and healthy lifestyle and proper hand washing etiquette. And women, we cannot really underestimate that, particularly supported to produce hand sanitizer and liquid soap for distribution in the community. And they are trained others providing income, you know, for the mask, making masks and work to the community. And also similar project in other countries. I think this is, for example, in Kenya, we address COVID-19 in urban areas. We're working together with the DG of the Nairobi Metropolitan Services in terms of solid waste management. And at the end of the day, it's become a recovery, employment opportunities for the youth and women in recycling and also in circular economy. Next. And to address the imbalance effect of the pandemic on the most vulnerable group, generally women and other people. So I think the needs of children and people with disabilities, we notice that the young people play a very critical role in information dissemination. It's very important for us to communicate and to inform them the logistic and the distribution of relief material to these communities. With all this information, we even translated into their language, to the local language. I think this is very important. And another one is innovative capacity of the youth to use art, to rely on them to use art to communicate what is COVID-19, what shall we do during this pandemic. So we conducted this to raise awareness, especially in Fiji and in Lebanon, and we use young people in Kenya, in the other part of Africa, to use their painting, the local artist skill, and you'll be surprised that they are all that creative. This is what I meant with the local solution, community driven. It's simple but yet powerful message on how to stay safe from the virus. So local arts in Kibera, Matare, informal settlement in Lebanon, in Fiji, in Ghana. So we have a lot of a program on this community-driven solution because they know very well what works and what doesn't work in their community. So this is an example of the beautiful artwork to remind people to continue with safety measures, physical distancing, washing hands, and pay tribute to those who help keep our community safe. Next. But from these various programs, what is the next? Yes, we have the short term. In March, we have the launch the COVID-19 response plan in April, and we see the result after 6 months. What's next? I think this is really needs of we rethink in terms of the planning of our cities or our countries or even our communities, where we put health and development. There need to be a resilient, a gender equal green economic recovery. The needs to allow further technical expertise. We need data. We need to continue to reinforce our support to member states in generating urban data system and platform. We understand the digital divide now. This must be addressed because half of the world population are not connected. So I think there have to be new ways for those without digital access to engage and share efforts. So the needs of the integrated planning is very important, and investing in basic services. I think it's very much in line with UN Habitat Strategy Plan because we have four domain and 12 outcome. One of them is reduce poverty and also looking into the urban-rural linkages. This is proven during the COVID-19, how is the effect on the rural areas, intermediary cities, and also the mega cities, food productions and all that. This is very important for us to look into this. And at the same time, to look into the social economic impact that link urban finance and spatial inequalities. I think the land use planning, the spatial planning is really very important for us to really now relook whether we are in the right way and the rethinking the way that we plan the cities. This is where the next, as I mentioned to you just now, we are now preparing our new publication hopefully will be published by end of this year or early next year about the future cities. What do we see in UN Habitat, and also with the people that we work, the future cities will be. Next, please. And again, these are a few areas that the few photographs that our work on the ground. But before I would like to end with, we have to look into the building, the health, and the development nexus, building, health, governance, and urban finance, understanding better the role of urban planning and infrastructure in the post-COVID-19 recovery, if there is a post-COVID, or maybe in the pandemic. And we have to analyze socio-economic impact, urban finance, and spatial inequalities, at the same time promoting investment in very basic services, water, electricity, sanitation, affordable housing, and also slum transformation. So we need integrated and holistic approach in planning, in economic, in physical, environmental planning, and engage all level of partners. So that is the end of my presentation. I hope that I'm being fair to the participant and the distinguished delegates, and if any other question, then I'm free to answer. Thank you very much for giving me this opportunity. Back to you, Dinesh.
Thank you, Edie Maimunah, for highlighting the role of UN Habitat in helping vulnerable communities and cities during this global pandemic, as well as engaging cities as we work towards a post-COVID-19 future. Before we move on to the moderated dialogue, let's reveal the results of the poll question that we asked you, our audience, in the waiting room. Now, we asked you, what has been the biggest challenge faced by developing cities during the pandemic? And it's interesting to see that, of course, medical issues take center stage. Almost half of you talked about the capacity to test, trace, treat, and quarantine affected people. But following very closely after was safeguarding jobs and businesses. All right, that sets a stage for our discussion now. Let me introduce our guests for the moderated dialogue and audience Q&A. On the panel, we are pleased to welcome Mrs. Bindu Brewer. Mrs. Brewer is the Chief Resilience Officer for the city of Painesville in Liberia. She has worked in the Liberian government since the country's political transition in 2006. She most recently served as Chief of Staff for the Senator for Margibi County. Prior to this role, Mrs. Brewer focused on urban planning and development at the Ministry of Public Works as urban specialist and is currently Senior Urban Policy Expert Consultant at UN Habitat. Mrs. Brewer attended the Singapore UN Habitat International Leaders in Urban Governance program in 2018. I'm equally pleased to introduce Dr. Muhammad Adam Mohammed, or Dr. Ida. Dr. Ida is County Executive Committee member for Health Services of the Mandera County Government in Kenya, a medical professional by training with more than 20 years in civil service. Dr. Ida has worked in various urban and rural hospitals of Kenya. He also served as the chairman of the Kenya Association of Muslim Medical Professionals between 2014 and 2017. And in addition, he is a founder member and country representative for the World Islamic Health Union. Now, our guest moderator today is Dr. Zaheer Allam. Dr. Zaheer is the author of 8 books on the subject of future cities and works on a number of projects on the theme of smart cities, technology, and culture. He's the African representative of the International Society of Biourbanism, member of the Advisory Circle of the International Federation of Landscape Architects, and a member of several international bodies. For his contributions to society, he was elevated by the President of Mauritius to the rank of Officer of the Order of the Star and Key of the Indian Ocean, the highest distinct order of merit in Mauritius. Zaheer is also a 2018 alumni of our Singapore UN Habitat program and a World City Summit Young Leader, and we're glad to collaborate again with him here. With that, Zaheer, the mic is yours.
Thank you, Dinesh, very much for this introduction. Coming to the discussion at hand, what I find fascinating is that we are witnessing disruptions at truly an unimaginable scale. I remember that at one point in time, I think it was in April, it was reported that 3.9 billion people in over 90 countries were locked down. That's half of the world's population. 2 months ago, a report by the World Health Organization highlighted that over 90% of countries witnessed disruptions on health services. And those disruptions expanded well beyond to other dimensions, not only retaining itself to the health sector. And now coming to cities. Lockdown really made us question our perceived notion of resilience. With subsequent lockdowns, with the upcoming second wave of the virus, we see rising concerns of unemployment, inequality, impacts on service delivery, quality of life concerns, and it's not only in specific geographies. Our webinar poll of today highlights the same results. And on the other end, we see the challenges, but we see emerging urban policies as pandemic response, like the 15-minute city of Carlos Moreno, which is being implemented in Paris, and the need for sustained partnerships and collaboration, like the present MOU between UN Habitat and the government of Singapore through the Center for Livable Cities. So we are witnessing quite an interesting dynamic. And perhaps going to our first question to ED Maimunah. We see that the pandemic, due to lockdowns, has caused our cities to become ghost cities. And this has abruptly changed our urban lifestyle. How do you see these changes impacting on the future urban planning of our cities?
Well, thank you very much, Dr. Zaheer, Allam, for the questions. I think as you put it very correctly, half of the world population locked down. And what will happen to the economics, to the social, to the physical and environment? Yes, it's become the ghost town, and it's really changed the urban lifestyle. And I think this is also giving, as I mentioned in my presentation earlier, in my opening remark, is a wake-up call for us to really look into the rethinking in terms of the design of our cities. So first of all, I think cities need to continue. Even though it's locked down or become a ghost town, but the services, the needs of the people in the city is still there, and the services still need to be rendered by the local government or by the government of any country. So I think this is very, very important, because I have the opportunity to keep in touch with more than over 1,000 cities worldwide. And I have a chance also to talk to mayors and the local government leaders through the UCLG Metropolis and City Leaders webinars. And they are crying for help, meaning that is even in one of the webinar, one of the participant, the speakers, cried in the webinar, please help us, what shall we do? We are now the front line to give the response to the needs of the people in the cities. And what are in terms of the health response, in terms of the socio-economic impact, and also in a way that is the people still need to be to have food on the table, in terms of education, in terms of the mobility, and of course as the urban poverty and inequality or equity between the rural and urban and the different people is really being felt at that time. Of course, the wealthy citizen and those who can work from home choose to leave city to the suburb. But for highly globalized cities, this brought enormous economic challenges, and the service workers in the economic sectors remain. So in many cities, they lost job. And people on the rural area, they have problem in bringing in their goods to the cities, their produce to the cities as normal. So I think the impact of the informal sector and informal settlement is very, very bad in some countries, and resulted in also in the out migration from cities to rural and rural to cities, and many lost livelihood overnight because they cannot pay rent. Unless there is a policy in that country or in that cities to waive rent for the time being, giving the stimulus. So there is also a problem when the government have the few maybe million US dollars for the stimulus. Whom should this stimulus go to? They need data. Where are these people? So they are desperate at that time. So I think what is very important is that now we really have to look into the situation. During this COVID-19, I think many government would put people at the center. If we can put people at the center now, why can't we put people at the center when we are doing the policy next in terms of recovery? And if we can do at the moment now, that giving the stimulus, trying to get the people, the homeless people in to house them, and trying to have the education system, why can't we continue this good policy, a good intervention, even during recovery and after? We cannot go back to the old normal. We have to move forward. So I also would like to see how we can advise the local government, UN Habitat, been trying to reorganize the crowded market into a safer places, more distancing, more informal traders can work. As you mentioned just now, we are now looking into how we can, the strategic planning, which already started now, more public space, more biking lanes, more so-called 15 minutes cities. I think when I was a student in my first degree, I was taught by neighborhood planning, neighborhood planning, and now we should go back to the very basic services, sanitation, water, and looking into nature-based solution and plan for our people, and of course in terms of mobility and the smart green planning and green law. I think this investment, there are still 70% of the future investment is not built yet now by 2050. Let us think the new strategy, the new infrastructure design for that 70% of the new infrastructure that you want to build. So I think this is very important for us to redo the rethinking, to do integrated planning, so that we can plan and build cities better, resilient, safe, and also make people at the center of the decision. Thank you very much, Dr. Zaheer, over to you.
Thanks, Dr. Maimunah. I find it very interesting that you mentioned the urban-rural migration, and even if we are witnessing this at such a large scale, you mentioned that, and rightly so, that services, the basic services of countries, regions, remain in cities. So it is paramount to safeguard the livelihood of those cities. And through this, we can witness how the role of cities will retain its primary role even after the pandemic. And it's quite also interesting to see that cities are still the centers for innovation, because they host the major activities of our economy, as you mentioned, and the need to put people at the center, and the need for rethinking. And of course, all of this goes back to the issue that the pandemic remains an issue of public health, and we need to first turn towards transdisciplinary solutions. And perhaps going to our next speaker, Dr. Ida, looking at the issue of public health and how it is at the center of urban policy. It comes at a very interesting time, as Edi Maimunah highlighted in her keynote, of data exchange and technological integration in the urban fabric. Through this pandemic, we are seeing how the issue of technology and data are influencing urban policy. How do you think this approach will sustain in the long term?
Thank you very much, Excellency Madam Edi Maimunah, Minister Indirani, the panelists, and everyone attending from diverse places. Good morning, good afternoon, good evening. It is a pleasure to take part in this. As has been correctly asked in the question, the current COVID-19 pandemic has completely upended all normals that we used to know. Kindly go to the next slide. So as you know, this is the current situation is something that the current generation has not witnessed before, and therefore we have got all sorts of our world coming, down. So the virus has created a new sort of socioeconomic. It has affected the political, socioeconomic fabrics of the society. It has created things that were initially not in our own thinking. And therefore, this now calls for adaptation mechanisms and trying to cope with the situation, and maybe also make use of opportunities that are there right now that came as a result of COVID to make sure that we build a better future throughout the world. Next. Has been correctly put, disruptions are there everywhere. Some are very, very pronounced. For example, in our social life, limitations. The worst thing that we have seen during this COVID pandemic is people not able to say goodbye to their loved ones who are affected and are in hospital. Beside all the other limitations that you can see in weddings, in burials, and so on and so forth. When you look at the economic aspects of lockdowns, has got its own consequences, leading to redundancies, loss of business, revenue, as well as, giving negative spiral effects of, mental health issues. Again, this is a phenomenon that we are seeing. And it makes those who are already vulnerable in one way or the other, tip over to the side, to negative side of life. Therefore, I will say that COVID is both a very huge public health problem. It has exposed areas that were previously neglected in terms of linking policy and urban planning to aspects of public health with all its ramifications. Therefore, to cope up with the current disruptions, we must have a mid and long-term plan, because most governments have applied the short-term plan. Next slide. Just go to the other slide. Next slide, please. The other one. Thank you. So currently, what can we do in the environment that we are living in? We must focus on building on what we have in terms of the advantages that we have currently. That is linking public health and urban planning, as well as trying to create urban digitization and sustainable communities, emergency mobility networks, environmental and natural disaster plans. So we have to have a whole continuum of linking every aspect of our living to improve in future, because this is one pandemic. We may have a situation, we are going to have another one. We must also try to leverage on technology that is there in terms of trying to reach those who are not reachable. We must have a system of social justice, a system of mapping those who are vulnerable. That is social mapping. And apart from COVID, I must say that those who have been living in informal settlements are the ones who have been worst affected. Therefore, we must also find a way of linking the informal settlements, that is the slums, as well as those involved in informal economies, to the formal systems of planning for everybody, so that we do not have slums in cities. We must have affordable planned housing for every sector, including those on the lower socioeconomic strata of the community. We must also think about, like Madam Maimunah has said, trying to link and improve the systems in the hinterland, because when you find every aspect of development being concentrated on the cities, we have a situation in which the hinterland is left behind, and diseases are usually migratory. The moment there's an outbreak somewhere, they will surely find the hinterland. Next. Next slide, thank you. Then we have got new challenges that, like I've said, but more importantly, the opportunities that is there. So the opportunities that we need to leverage on, number one is, the world is a global village. For us to survive, we are all having the same kind of problem, the COVID-19 problem. So we need to reorient our planning. That is one. We must have social mapping of those who are vulnerable, so that we take care of all the basic aspects of all communities that live, regardless of their status. And like I previously said, I think this is an opportunity to reflect on what were the areas that we neglected before. We have got a situation where we have got health inequalities, we have got economic disparities, we have got opportunities in which planning can be made right in terms of availing all aspects of public health being integrated in our daily living and planning. So in brief, that is what I can say, and I'm ready to answer any other question that's posed.
Thank you, Dr. Ida. Listening to you, I find it very interesting that you mentioned something that I personally wouldn't have thought about when looking at the pandemic. Reading on the news and on all the technicalities, the challenges of the pandemic, I would have thought that we have to go into a very technical approach, very academic and all. But listening to you, you approach kind of the issue of technology differently. You offer perspectives that technology is not only about contact tracing, but also about the need for messaging for quicker reach, to reach people faster. And you take the example of a very humane dimension of the need to use technology, for example, to say goodbye decently to families. And this is quite interesting. And you touch on the social dimension, the need for social justice, and technology and public health as a means and a tool, perhaps, to build cities better. And as Maimunah said, cities for people. And I think this is very interesting. And hearing from you that the legacy, if we apply those technologies, the legacy we can leave for cities would be incredible. But also looking at this, the issue of public health is not only limited to itself, it is a linear dimension going through other dimensions. And as Maimunah mentioned earlier, cities must keep living, but then comes the challenges of what do we do for service delivery in cities. And I turn to the next panelist, Mrs. Brewer. My question to you would be, can you share your work in infrastructure and public service delivery in Painesville and Liberia, and how the delivery of these public services pursued even during the pandemic? How important was the dialogue of politics in this exercise to build trust and to ensure the safety of everyone?
Thank you, Dr. Zaheer. Okay, as Dr. Zaheer introduced me, I'm Bindu Brewer. I'm the Chief Resilience Officer in the city of Painesville. And our work is mainly focused on waste management due to the centralized government system in Liberia, and also due to the lack of capacity for planning and the lack of urban practitioners in Liberia. So what we do is mainly collect waste and focus on ensuring that the CBDs or the smaller businesses who collect waste are doing so in the right manner. In terms of COVID-19, we looked at this as an opportunity to keep our citizens healthy and avoid underlying conditions should they contract COVID-19. Prior to the outbreak, we had community participation in collecting waste management, and we would all work together. We had something called First Saturday of the Month, where every community, instead of going to work, would come out and be involved in the collection of waste. And due to the COVID-19, of course, we had the lockdown, where we were prevented from coming together as communities and working shoulder to shoulder. Although we locked down all of the other city functions, waste management activities had to be ongoing, that they were considered essential staff to help keep our communities clean. In addition to that, we worked with community leaderships to ensure that hand washing stations and face mask wearing was going on. So before you entered any community, they would have a rope going across the road, and before you enter, you wash your hands with soap and water, and then make sure that you had to wear your face mask as well before entering into communities. I'm very excited to hear Dr. Maimunah and Dr. Ida's presentations today, focusing on the slum communities or the informal communities. 70% of people in urban areas in Liberia live in slum communities, and they have not really been counted in terms of data. There's no data on these people, where they live, how they live, and it makes it difficult to plan any kind of activity in the country without taking into consideration 70% of your population. So I'll stop there, and I hope I've answered your question. If you have any follow-ups, you go, oh, the political aspects of it. Well, politically, as I said before, our function as local government officials are not taken as, I don't want to say taken seriously, but we don't have the kind of weight of authority that the central government leadership has. So we have not really been as involved in making those decisions or in the food distribution. All of these things were done on a national level, and deciding who gets the stimulus, which was in the form of food distribution. So politically, we could have been more involved in the processes, but we weren't the first point of contact for this.
Thank you, Mrs. Brewer. It is quite interesting listening to you. Like you point out the scales of political structures and the need for inclusive policies and its application. And also how it is important when looking at communities and working with communities, how we really go deep into the different levels and not only stop at the primary levels of local government. And this is quite fascinating. Maybe because we're running quite a bit of time, I would like to ask the panelists if, for one question, and if you could reply succinctly, what do you think would be the areas which would be the most or least impacted of the pandemic, and what do we need to do to solve those? Maybe in a few words as a wrap up. Maimunah?
Thank you very much, Dr. Zaheer. I think if the few words I would like to share with the participant, we have to go back to basic. What is the basic of human rights? Basic to basic services, water, electricity, housing, and everybody want to have a good quality of life. What is a good quality of life? I think once we have already attained the basic right of a human being, I think that is the litmus test of the COVID-19. Then we can look into a further, the basic for education, basic for healthy people, have healthy body, basic for healthy mind, basic for healthy food, basic for healthy environment to stay. I think that is a very important. So my message is that go to basics and look for the technology to bypass the needs to provide the basic services for the humankind. Thank you.
Thank you. Dr. Ida, in a few words.
If I may pick just two most important areas. One is health. Once we have got a dynamic where everybody gets access to basic health services, this makes it very possible for communities to survive this pandemic. In Kenya, right now, we are rolling out universal health coverage to every citizen who is in this country. Those who can afford will pay for their social insurance. Those who can't will be subsidized by respective counties and national government. So that means every citizen is going to be covered in terms of the basic health necessities that one requires. Otherwise, if we are to start paying for services, it actually locks out a very huge number of people who are in the lower socioeconomic strata. The second most affected aspect of life is economics. We have to try and, like I say, do social mapping of those who are vulnerable and also provide incentives for people to pick up their lives from where they are, so that those who are isolated and maybe they are breadwinners must have, their family taken care of by the government system. And those who are are able to support the others, then it can go on. So a lot of things need to be done in terms of trying to stimulate economic growth, even in the virtual world as it is. At the same time, also social justice and social mapping, so that we sort of cushion the vulnerable communities against the very real danger of economic downturn.
Thank you, Dr. Ida. Mrs. Brewer, any last few words?
Yes, I'll just build on what was previously said. For us, I think our takeaway from this pandemic has been noting the inequality of our people. It was difficult when we first entered lockdown because, I mean, we were said to have to stay home for 2 weeks. Well, who can afford to buy 2 weeks worth of food and sit home and not work and not go in the market? You know, that's left to 20% of your population. As I said before, 70% of us are living in abject poverty. So just the basic equality when we are making policies, when we're making decisions, when we're planning for communities, needs to be taken into consideration.
Thanks. I find listening to this panel, I find this discussion fascinating, truly fascinating, because through this interaction, we understand the breadth and scale of issues. It is, yes, a public health emergency, but it demands a multidisciplinary action plan and across different scales. And this is quite important to reiterate this listening back to you. With the economy, society, and yes, environmental domains in line, we understand that we need to be prudent. It is, as Maimunah said, a matter of human right. And we need also to be innovative for our own survival, but also for the prosperity of our cities, which retains its rank in order of priority and economic power. Through this exchange, we know that it is not only a matter of policy, but also that of gaining community trust and scaling projects for also shared ownership, which is quite an interesting point I noted for this panel. I would like to thank the audience for sharing the questions that helped shape the discussion today. And thanks to the panelists. I leave here today enlightened and inspired. Thank you for this. I pass the mic back to you, Dinesh.
Thank you, Edie Maimunah, Mrs. Brewer, Dr. Ida, and Dr. Zaheer for sharing your insights and your time with us today. We appreciate it. Our next and last webinar for the year will be back on a Thursday in 2 weeks, on the 19th of November. Our webinar is titled Resilient Rotterdam, Green City Lungs for COVID-19 Recovery. In a fireside chat, Ahmed Abu Talib, the mayor of Rotterdam, will share with Jeyaratnam, Singapore's ambassador to Belgium, the Netherlands, Luxembourg, as well as the European Union, on the city's plans to build more green public spaces in response to COVID-19. Please register to attend using the QR code or the link. This webinar has been live streamed on CLC's Facebook page, and we'll upload a recording of it tomorrow on our CLC YouTube channel, where you can find over 500 other videos, including this interview with the Mayor of Painesville, Pam Belcher. Finally, thank you to you, dear viewers, for your participation. We hope you find these webinars useful. Before you leave, please use the QR code or link to fill in our feedback form. Do tell us what works and how we can do better. We've come to the end of today's webinar, but we will be leaving this room open for another 5 minutes. Feel free to use the chat box to exchange comments with each other, as well as the speakers and moderator who have indicated that they will be able to stay back to interact with you a little bit more. Until our next webinar on the 19th of November, goodbye and stay healthy.